Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Today we are going to discuss a common medical procedure, the anorectal examination. This is a topic that can sometimes cause apprehension, but our goal is to demystify the process by explaining what it is, why it is performed, and what you can expect. It is a fundamental diagnostic tool that provides doctors with crucial information about your health. The exam itself is a physical assessment of the anal canal and the rectum, which is the final section of your large intestine. It is typically a quick and straightforward procedure conducted in a private clinical setting. The main objective of this guide is to provide clarity and reassurance. Knowledge is a powerful tool, and understanding a medical procedure can significantly reduce anxiety. The anorectal exam is designed to investigate a variety of symptoms, minor discomfort, more serious conditions that require prompt attention. By carefully inspecting the area and feeling the internal structures, a doctor can gather immediate insights that might not be available through other types of tests. Let's delve into the why behind the anorectal exam. The primary purpose is diagnostic, a tool for investigation. It helps a physician pinpoint the underlying cause when patients present with symptoms, often the first step in evaluating lower gastrointestinal issues. Example: rectal bleeding. Example: pain during bowel movements. Example: a noticeable lump near the anus. The exam allows direct, immediate assessment. It helps differentiate benign conditions from those needing urgent workup. Indication: bright red blood on toilet paper. Indication: bright red blood in the toilet bowl. Often points to hemorrhoids or to an anal fissure, a small tear in the lining of the anus. Other indication: persistent anal itching. Persistent anal pain. Feeling of incomplete bowel evacuation. Sudden, sustained change in bowel habits. Presence of pus or mucus discharge, possible infection or abscess. Unexplained weight loss with bowel symptoms also warrants evaluation. Contraindications exist, situations to postpone or avoid the exam. Severe, excruciating pain, consider imaging under sedation. Massive active rectal bleeding, emergency stabilization first. Known severe bleeding disorder or extremely low platelets, specialist input is advised. Proper preparation is key to a successful and comfortable anorectal exam. This preparation involves both the medical team and the patient. Medical team, the patient. For the healthcare provider, the first and most important step is clear communication. Explain what the procedure entails, why it is being done, and what you might feel. They will ask about your medical history, including any known allergies, especially to latex or lubricants, current medications like blood thinners, and any pre-existing conditions, such as heart problems. This conversation builds trust and ensures the procedure is conducted as safely as possible. From the patient's perspective, preparation is generally minimal. You do not need to fast or perform special bowel cleansing before a standard digital rectal exam. Your doctor may suggest you try to empty your bowels before your appointment. It is important to communicate openly. If you are anxious or in significant pain, tell your doctor. They can take extra steps to ensure your comfort. The clinical environment prioritizes dignity and privacy. You will be asked to undress from the waist down in private. You will be given a drape. You will be given a sheet. A chaperone should be offered, and you have the right to request one. The exam room should be warm and private to create a calm atmosphere. These measures are standard of care to reduce stress. Pain control and comfort are paramount. If you're in pain beforehand, your doctor may suggest an over-the-counter pain reliever. During the procedure, a generous amount of medical-grade lubricant minimizes friction. Some physicians may apply topical anesthetic gel, like lidocaine, a few minutes before the exam. Your cooperation, relaxing your muscles and breathing slowly, helps make the exam smoother and less uncomfortable. The anorectal examination proceeds through a clear, methodical sequence of steps. First is positioning. The most common position is the left lateral, or Sims position, where you lie on your left side with your knees drawn up toward your chest. Another option is the dorsal lithotomy position, where you lie on your back with your feet in stirrups. Your doctor will choose the position that is most appropriate for the exam and most comfortable for you. The exam begins with a visual inspection. The doctor will gently separate the buttocks to look at the skin and the area around the anus. They are looking for skin tags, external hemorrhoids, rashes, inflammation, fissures, the opening of a fistula. You may be asked to bear down gently as if having a bowel movement. which can help make certain conditions more visible. This external check is quick but provides valuable initial clues about your condition. Next comes the digital rectal exam. The doctor will put on a glove and apply a liberal amount of lubricant to one finger. They will inform you before they begin the internal part of the exam. They will gently press their lubricated finger against your anus, asking you to relax and breathe deeply. As you relax, the sphincter muscle will open slightly, allowing the finger to be inserted gently and slowly into the rectum. The doctor will systematically feel the walls of the rectum, checking for any lumps, bumps, areas of hardness or tenderness. In men, the prostate gland can be felt through the front wall of the rectum. In some cases, the doctor may need a more direct look inside the anal canal and lower rectum. An anoscope is a short, rigid, hollow tube, often made of plastic, with a light source. After the digital exam, the lubricated anoscope is gently inserted a few inches into the rectum. This allows the doctor to directly visualize the rectal lining to identify internal hemorrhoids, fissures, inflammation. This part of the procedure takes only a few moments. Throughout every step, the doctor should be communicating with you and will stop immediately if you experience significant pain. Once the examination is complete, you will be given privacy to clean yourself and get dressed. Your doctor will then return to discuss the findings with you in clear, simple terms. The results of the exam can often provide immediate answers. For example, if the doctor identified classic internal hemorrhoids or external hemorrhoids, they can explain that these are swollen veins and are a very common cause of bleeding and discomfort. If a fissure was seen, they will describe it as a small tear and discuss how to help it heal. This immediate feedback is one of the great advantages of the anorectal exam. Based on these findings, your doctor will outline the next steps and provide aftercare advice. This might include increasing fiber and water intake to soften stools, taking warm baths to soothe the area, using over-the-counter creams or suppositories to reduce inflammation and pain. If an infection or abscess was suspected, a course of antibiotics might be prescribed. It is important to understand what the different findings might mean and when more testing is necessary. While bright red blood often points to hemorrhoids, a hard lump discovered during the exam requires further investigation to rule out more serious conditions, such as a tumor. An ulcerated area also requires further investigation. In such cases, your doctor will explain why a follow-up procedure like a colonoscopy is needed, or a sigmoidoscopy. These tests allow for a more extensive view of the colon and the ability to take a biopsy, which is a small tissue sample for laboratory analysis. Finally, you will be given clear instructions on when to contact the clinic. Minor spotting of blood or mild discomfort for a day after the exam can be normal, but you should call your doctor if you experience heavy bleeding, develop a fever, have severe or worsening pain, or notice any new swelling. Your health journey doesn't end with the exam. It is simply one step in the process. Thank you for joining us. If you found this information helpful, please like, subscribe, and share by clicking the buttons below.